That lease agreement stipulates that certain services need to be provided, and the Cleveland Clinic could not cancel that without our mutual consent. However, that doesn't protect us against what are significant health care delivery issues. It's appropriate that we tee up for our community conversation one of the most interesting and challenging subjects, and that's health care delivery in the United States going forward. The matter is, as we look to 2027 and beyond, and it's important to think in terms of the specter of that length of time, that we have to take into the major shifts that are ahead when we move from acute care, where you're sick and you're in a bed, to basically preventive care. And if you are sick, you very likely may be in a bed, but it may be your home bed. And the implications of a health system that delivers that kind of service versus one that was built in Lakewood 80 years ago. There are tremendous changes occurring in healthcare today. There isn't a day that goes by that we don't read about the impact and the drama. And those changes are going to be even more so in the future. The dramatic shift that we're seeing is based on a shift from activity-based care and the costs that go with the activity-based to outcome-based care and outcosts. A 180-degree turnabout on how historically we have approached healthcare in this country. The idea of waiting till you get to a hospital is increasingly a notion that isn't as appropriate. The idea that healthcare is going to come to you is really the notion of the future of healthcare. Technology is rapidly changing the landscape of not only how healthcare is delivered, but just as importantly, where it's delivered. The region has 35% excess capacity. There's a major trend towards outpatient care. Health reform initiatives will result in a nationwide reduction of hospital beds. So we've got to work closely with the Cleveland Clinic Foundation. We are doing that. Our trustees are dedicated, vigorous folks. Lakewood Hospital trustees are preparing for these changes, and the trustees are being very proactive, not reactive. But I think the more important story is the technology that's used in medicine today. Now, Lakewood is the proud owner of a 100-year-old community hospital designed to serve medical services in an entirely different time and place. Now, we are partnered with one of the greatest healthcare providers in the world, the Cleveland Clinic, and we are working closely with them to understand the implications of repositioning this hospital for its second century. And we believe the clinic is committed to working with us to do so, but we think this is a very lively, thoughtful conversation. The trustees of Lakewood have taken upon themselves to consider these issues very thoroughly and very seriously. So we're going to be meeting on this subject. It's a complicated one. It has many, many dimensions to it, and we're going to have to sort all this out and make some big decisions going forward. And we do not want to begin this complex conversation with just a few years, because we think this is pretty big, pretty important, and all doable, and time is our ally if we begin now. So that conversation is clearly upon Lakewood. And I'm certainly more confident today than ever that Lakewood citizens will be well served by a modern, sustainable healthcare system that will serve our needs of our citizens both now and decades from now.